Doug Alexander here again. I'd like to discuss some of the principles of working intraorally. So we did an assessment. We found out that there's lots of tension in the masseter muscle. We talked to our client. She's got a good idea of why we'd want to do this. She's given us permission to put a glove on and to do the treatment. And we also have a hand signal protocol, which is not going to work because your hand's underneath the sheet there. So could you just sort of bring that arm out a bit? Fabulous. There you go. So the other thing you notice is I put the glove on. We were doing things in the studio, and I realized, like, my goodness, I had the glove on. I'm like handling all these things. So I threw that glove out. So yeah, make sure that when you put a glove on, you'll be doing things. Yeah, you don't reach down and move the stool around everything with your gloved hand, because that's your gloved hand is in contact with all these things. So this is not a sterile glove. It's a clean glove. Just like most of the food we eat is not sterile, it's clean. So, we can put clean things in our mouths. But, yeah, make sure the glove doesn't get in contact with anything in the environment. Yeah, so to review, I'd like to stick my finger in your cheek and work our way back and see if we can get some of this tension addressed in your masseter. You still feeling good about that?
Sure.
Okay. And if you want to break, then you just raise your hand, wiggle your head, either way, and I'll take my finger out. Okay, so let's see what's going on. So ouvre a little bit. So I just bring my finger across the lip a little bit. So now it's moistened so I can slide back easily. You can just relax your jaw. Yep, that's great. And then I like to have the person's neck in a comfortable position. If they're all kinked around, then it's not going to be helpful. So I go neutral, or sometimes a little bit of a roll toward me. If I'm not sure where I am, because you don't know sometimes, people's mouths have got a lot of different architecture, just like people's bodies come in all sorts of shape and size. People's got broad shoulders or narrow shoulders. People can have broad jaws, deep jaws, narrow. So I just ask her, Molly, could you just clench your teeth for a moment and then relax? So as Molly clenches her teeth, the muscle jumps up into my finger, and I know that I'm on the edge of it. So I started the zygomatic arch, and I scan for tension in the muscle. I get a little bit of a sense of that, and then I take my finger out. How's that going for you?
Good.
Good. So I have to walk the walk. Talk the talk, walk the walk. I have to demonstrate that I don't really care how many times I stop or start. It's really that Molly feels comfortable with what we're doing. So let's go again then. So a lot of people will use like a pincer grip like this, and I'm sort of an anti-pincer grip person. When I do that, then there's tension created in my hand here, and that's analogous to telling your children to relax and stop hitting your brother. They might stop hitting each other, but as soon as you walk away, they do their thing, because you're just putting more tension into their system. So, thank you. So what I suggest is a really relaxed finger. And to achieve that, I also like to rest on the person's shoulder, but I ask their permission for that. So, yeah, how are you doing with me resting on your shoulder
Great.
there? Okay. So if they're not comfortable with that, then I need to put a pillow or something. Because if I'm holding my arm up, there's all this tension in my arm, and that's creating noise. If I was a jeweler working with a fine piece of watch, then I wouldn't want to be doing that on a city bus, trying to do that. So you need to have a system where there's minimum relaxation in my body, so there's maximum sensitivity, and the message that I'm giving my client is that, yeah, it's okay to really relax and let go. So, ouvrez s'il vous plaît. And then, so my inside finger is really relaxed because my arm's relaxed, this shoulder's relaxed. This is resting on the table, and it's actually a little bit dragged down. So I'm just going to pop that up, if I can find the direction that up is. There we go. So now I'm as comfortable as I'm going to get today. How are you doing there?
Great.
Okay, so this is for real now, right? It's just like we've been doing all that talking. Let's feel what's going on. So this is the edge of your masseter muscle, and actually it's really soft and relaxed up at the zygomatic arch. So my inside finger is underneath, it's subjacent to the muscle, and my thumb is outside the muscle, and I'm just very, very gently compressing the muscle into my subjacent finger. and the muscle is silky and soft and smooshy. As I proceed down, toward the attachment onto the mandible, then the consistency of the masseter changes. And there's more tone there, and then it's actually pretty good down here. There's a nice chubby knot in here. So the inside finger is fairly passive, and I roll tissue on top of it. When I find some material, I'm just going to, can I turn your head like that? Just so the camera has a good angle on that. The consistency of this tissue is, it's firmer, and it's got personality to it. So I can feel all sorts of structure in it, which means the different motor unit territories within the muscle have got high tone. So at this point, I have options. Okay? At this point, what I could choose to do is I could like really massage that thing firmly or do some kind of like really challenging neuromuscular technique. But my sort of operating hypothesis is this universal precautions that people have really been, it's quite possible that they've been injured in some way in their jaw. So I'm not going to treat them that way if I don't have to. So ouvrez again and relax. So I'll find this high tone element right there. And all I do is I compress with the outside thumb onto the inside finger until the compressive force between my two digits meets the internal resistance of the tissue. And then I hang out and relax. So as I'm doing this, we'll ask Molly in a second what she's feeling, but her tissue is actually sort of gently writhing. It's kind of sliding and slipping. So my interpretation of that is that neuromuscular subvolumes within the masseter are relaxing, and as they do, the remaining hypertonic fibers are gliding on the newly softened fibers. So I have this feeling of the muscles kind of really doing this like fabulous, sea mammal kind of thing. Okay, now it's stopped doing that, and now there's a whole other shifting. The whole tissue's softening in another way. So what I'd like is to get, and now it's stopped again. I want to get 3 releases of this type. This thumb is not doing anything. It's just kind of hanging out there relaxing. And then the tissue's sliding a little bit more. I was getting impatient, so I was kind of sliding it. Actually, it's just hanging out. And there, now it's giving again. There we go. So if I was to reevaluate for tone, this area that was so interesting is less interesting to me now. Yeah. What did you feel when I had
felt good. I kind of felt some of that towards the end.
Some of that? What was that?
Where it was kind of just relaxing and smoothing down.
Nice.
It felt good.
Good. So it didn't feel painful or uncomfortable. Nope. Yeah. So you can get away with this with someone even if you'd been to the dentist like 2 or 3 days ago and you had some post-exercise soreness from having your jaw like held open. This kind of touch, maybe at 3 days or so afterward, you can touch someone like that, and it's not going to make them more uncomfortable. Okay, can I do some more? Mm-hmm. Fabulous. Ouvrez and relax your jaw. So that's the strategy that I use, is this tissue tension balancing thing. And I work my way through the muscle, all the way from the zygomatic arch, all the way down to the angle of the mandible, the anterior third of the muscle, and then I go for the middle third. So your anterior third is quite relaxed. The middle third, that's where the tension really, there's a fair bit in there. So I work my way through in that way. I'm not going to take my time to do all of that at the moment. I'd like to show you the next kind of strategies I have. So after I've gotten that kind of release, then I like to, my inside finger is underneath the muscle, and I'm rolling the muscle from the outside with my thumb, rolling it onto my finger. Okay, so this is, what I did is we released the tension in the muscle fibers, and now if there's any kind of adherence of the muscle fibers to each other that's excessive, then I'm normalizing that. Sometimes I will reinforce with the, the ipsilateral thumb too. So we've got a rolling kind of a technique. As you roll, sometimes you're like, oh yeah, I'm more aware of the high tone there, and I'll treat that now too. There we go. So that squirming thing I was doing there, that's the muscles relaxing, and I'm going with that relaxation, and I'm exaggerating. So now I'm bowing the muscle in this S-shaped kind of configuration. And we'll just get one more release here. And as we're waiting for that to happen, what I suggest is if the person is not relaxing well, like if their tissue should be responding in 15 or 20 seconds, it should start softening. If it's not, then maybe you're really cranking their neck or something. You can ask them to take a slightly deeper breath. Take a slightly deeper, thank you, breath. And if that's not working, then often there's tension in my body. So I drop my shoulders and I straighten my neck out and minimize my spinal curves, and then suddenly, wow. Or I'll take a breath to relax myself, and their master starts relaxing further. So this is one of those like non-Newtonian worlds, that people's muscles, especially the masticatory muscles, they don't do what you tell them to do. They do what you're doing. So what a fabulous line of work, that the more relaxed I am, the better my work is going, the better my outcomes. Okay, so I was just doing a little bit of S-bowing with the master there. And then I'd want to do, get some more releases there, but just to show you a progression of strategies, the last thing I tend to do is to pick up the masseter. This is after I've got some good relaxation, and then I draw the masseter up toward the zygomatic arch. So I'm sort of doing a myofascial stretch of the masseter, or I can grab it from there and drag it down. Okay. So I've helped things change from this high myofascial tone, the muscle fibers mechanically stuck together and inelastic, to dropping the tone, increasing the elasticity between the fibers, and then along the length of the fibers. And I'll finish off with a myofascial facelift, which is my inside fingers holding onto the cheek, and I'll use a pincer grip there, and I'll use my outside thumb. And I work with all the superficial musculo-aponeurotic system and myofascially lengthen and open that. Take a slightly deeper breath there, Molly. Fabulous. So we get all the smiling muscles. We get all the frowning muscles. And so that's a nice way to conclude the masseter treatment. Mm-hmm. How are you doing?
Great.
Okay. One thing I'd like to emphasize is something that you don't do, and that's that usually when you get a trigger point out of a muscle, like if I get a trigger point out of my upper traps, then I'm going to want to really stretch, like orthopedically stretch that, and open it up and so on. When we get the tension, thank you, you're so enthusiastic. We get the tension under the masseter, and then open up, yep. Then we lengthen the masseter in this kind of manual way, but we're not moving the jaw. So you'd think that, okay, orthopedically stretch the masseter, what you want to do, open your mouth a bit. You could put your thumb along the lower set of teeth there, and you could really stretch the jaw open, and that would stretch the masseter. However, there's so many people that have got hypermobility, the joint moves too far, and that's why the masseter is full of knots. So that if you stretch the person orthopedically, you're going to hurt some people, like guaranteed. So that's why I don't orthopedically stretch the jaw, because even if the person's jaw opening is limited, it could be limited because the muscles have got high tone right now, but then as the muscle relaxes, you find out that they've got this normal opening more, and you're like, oh, the muscle really relaxing, they're really stretching. It's like, oh my goodness, they're coming apart. So, so don't stretch people's jaws, please, unless you're really well trained and you know what you're doing. So we were just having a discussion about, what's too heavy and what's too light in the intraoral massage world, and my, prejudice is better to do no harm. In some ways, it's almost hard to be too light if you're actually on myofascial tissue. It's common for people to stick their fingers in people's mouths and they're actually not on contractile myofascial tissue. So, it's not a question of like you're too light there. It's like, dude, like you're not on the stuff that needs to be treated. So if you're actually on myofascial tissue that's contractile, and if you're engaging in a very light way, again, the neurology is so sensitive that people tend to respond. But my guideline is you compress the tissue sufficient till you feel the intrinsic turgidity of the tissue pushing back at the same level. If you go beyond that, then you're going to create a lot of sensation. It's going to be really sore. And people can still sometimes relax into that. But if they really have a significant problem, then they're not going to relax into it. Or they're going to relax while you're doing that, but they haven't fundamentally let go. The problem is not that they can't relax when someone's fingers in their mouths. The problem is they can't relax when they're on the bus, or when they're at work, or when their boss says something to them. So they are in charge of their body at that point, and they can't relax. So the important thing is that they can sense tension and learn how to relax that on their own. Massage therapists come and go. That person's stuck with their body their whole life long. So, it's really, my prejudice is that really we're sort of, we're trail guides to people's bodies, if you will. We help them sense sensation and interpret it and then respond to it. It's not even that cognitive. They're like, oh yes, when I feel that, I'm going to stretch. It's like they feel something and they automatically do something different. That's the learning that happens when someone's tissue unravels underneath your finger, is that you've gotten rid of some tension that's accumulated, but they've learned something. And after 2 or 3 treatments like that, a lot of people stop grinding their teeth, and they stop chewing things, and they stop chewing gum endlessly. They actually don't even have to work at it. They're like, oh, yeah, it feels really tired when I do that. So that's my heavy light diatribe.